Thank you, Governor McKee. Thank you, Commissioner Infante Green. And thank you both for your tremendous commitment to the health and safety of the students throughout Rhode Island. We know how critical in-person learning is to ensuring that all students in every zip code throughout the state have an opportunity to thrive, which is why the leadership you both have had and focus on this area has been so critical. I also want to acknowledge the teams at the Rhode Island Department of Education, the Rhode Island Department of Health, and our whole of government COVID-19 team that pulled together this thoughtful, science-based approach. And of course, along with what's been said, I have to acknowledge the families and school communities throughout Rhode Island for a year and a half of unprecedented partnership. Your flexibility, patience, and commitment have been the step that has made the difference. We're going to keep working with you and partnering with you to make sure we are ready for a healthy, safe, and productive academic year for all students. As the governor said, we had set the goal that we want to enjoy this summer. We are achieving that goal. We hope all of you are accomplishing that together. Our next goal now is to make it so that we can come in the fall full in person as we are discussing here. I only had the mask on at the beginning to be able to show for all of the adults. Being fully vaccinated by the time school starts means that you would not have to wear this indoors, and that makes a tremendous difference. Despite how well we're doing with COVID overall in Rhode Island, we need to remain vigilant. We know the numbers have gone down. We know that we are in a great place. The same thing happened during the summer last year. Our key is ensuring that everyone who is eligible gets vaccinated between now and the fall, so that when cases start to increase, we don't have to have the same type of increase that we had last year in the fall that everyone remembers. The Delta variant that is circulating globally is more contagious than any other strain of COVID-19 that we have seen to date. And the COVID-19 vaccine works to keep you protected from that. Given how much work we have done already on the vaccination front, it's not likely that we would see a significant spike as much as we did last fall. But the more people who are vaccinated, the better we will be, and anyone who is not vaccinated would be even more susceptible to getting infected. We want to avoid any increases or clusters of case counts anywhere in the state come the fall, because we actually have the tools to do that. The more people we have vaccinated, specifically the more teachers, staff, and eligible students who were vaccinated, let's get to 100. There isn't any reason why we can't. The less likely it is that we'll see clusters of cases in schools or any type of disruption. We are going to be providing ongoing guidance, and should cases be identified once school starts, tailored recommendations and hands-on support on issues including quarantining, contact tracing, testing, and infection control will continue. As the commissioner outlined so well, many of the public health measures that people have become familiar with will still be in place, such as distancing, symptom screening, and an emphasis on structured, stable groups, particularly among our students who are not yet eligible to be vaccinated. However, we are adjusting how these tools are implemented to reflect the reality in Rhode Island, that we are in a better place, and we want to continue to be there. Our reasons for making such progress is our vaccination program, as well as our testing program and the treatment that's been available. Number one message here, from my standpoint, that's important to relay is vaccination is key. If you haven't been vaccinated yet, or a loved one, talk to them. Get access to what's available. The most powerful step that parents can take right now when it comes to COVID-19 is getting their kids, if they are eligible, 12 and older, vaccinated. When you look at the time interval required between doses, A student needs to get their first dose now to be fully vaccinated by the start of school. Now is the time. Let's make it that by July 4th, everyone you know, you love, you're aware of has received at least one vaccine, so that by the fall, everyone can be fully vaccinated. It's easier now than it ever has been to be vaccinated in Rhode Island. You no longer need an appointment to get vaccinated at most sites in Rhode Island. If you go to c19vaccineri.org, we've made our COVID-19 vaccine site locator the first thing that you see. You enter your address, then you get information and a map with the vaccination sites closest to you, including retail pharmacies, community clinics, hospitals, state-run and regional vaccination sites. You'll also be able to see what vaccines are available at every site. As a reminder, the Pfizer vaccine is the vaccine that children 12 and older can get. I'll wrap up by saying that Rhode Island schools, families, and students are going to have a great year.